Hi, my name's Manoj Krishna. I'm a spine surgeon. In a surgeon's career, some patients stand out because of the technical challenges they posed and the courage they showed in recovering fully from their initial very disabled state. And Mr. Lennon's case is one such I want to share with you today. Joe had a post discectomy syndrome, so he'd had a discectomy or more than one before. And as you can see on this MRI scan, the bottom two discs were really narrowed and I think were inflamed as well and were responsible for his pain. This is a cross section coming up now where you can see where the bone's been removed from the back of the spine. And he was on a lot of painkillers and really disabled when we first met. He was treated with a posterior lumbar interbody fusion operation where the two inflamed discs or degenerate discs were removed. A cage filled with bone was packed in the disc space, and the whole construct stabilized with screws and rods. We also put a spacer at the level above to protect that from wear and tear. The surgery took about 3 hours, and he was in hospital for a few days. Here's an X-ray looking at it from the front where you can see the screws, rods, and the spacer just above them. Here's Joe telling his own story, which I think is quite extraordinary. Evening, Joe.
Hello, how are you?
Good. Okay, so Joe, let's start by telling me how old you are.
I'm 56, I think.
56, yeah. Okay.
Yeah.
Now, you've had a long journey, and it's been quite a story. So start from the beginning and tell me how it all started with your back. When was the first time you had a back problem?
It followed an injury on the 12th of May 1986. I remember that date because it was an incident with someone who had problems with drugs.
Okay.
And,
you were working as in the...
It was a homeless shelter
okay.
for people with single homeless people, but also people with drug and alcohol abuse.
Okay.
So it was working to help support them and maybe get them out of that cycle.
So it's 1986, and
yeah.
Today is the 28th of May, 2013.
Yes.
So it's a long time ago.
It is, yeah.
Okay. So then what happened after that in 1986?
Well, just a few days after that, I collapsed and was taken into hospital and spent 6 weeks with x-rays, various tests, various scans, traction, none of which helped. And after 6 weeks of solid bed rest, not allowed out of bed at all, even to go to the toilet, nothing, I was given strapped up and sent on my way. But then between 1986 and 1988 there were about 12 admissions, which included all sorts of trial things. I had myelograms to try and find, and they really struggled to find anything.
Okay. This was before the days of MRI, I think.
Yes, there wasn't an MRI or any scan. So
yeah,
that's right.
Okay.
So eventually, even after they tried something which was a nightmare called a chymopoppian injection,
okay,
which apparently was a solution that
dissolved. Yeah, it's supposed to dissolve the disc. Yes,
yeah,
it's an enzyme.
Felt like it dissolved the whole inside of me, and things got very, very much worse after that.
Okay.
Then, following a discogram, they realised where the pain was, even though they could never really identify it. And after that, in I think 1988, there was the first discectomy.
Okay.
Which seemed to offer some pain relief, but only for a short time. And various things like physio was tried, even strenuous physiotherapy, like trying to beat it out of my system, working in a gym and weights and all sorts of things. This was a new idea from America. That didn't work. And in 1990 was the second discectomy again that was done. And that was after seeing a psychiatrist to see if I was imagining it. And he believed that I wasn't. And that was pretty embarrassing as well. to actually be asked questions about the death of people that I knew in Northern Ireland, about how that related to your sexual.
Gosh, that must be
life.
awful. And you go in with pain and you get asked all these
right.
questions.
And not only that, my wife was questioned as well.
Okay,
Which also was
so
embarrassing.
yeah, okay.
So there were I was a bit lost then, and after that, I decided to further my career and do a professional qualification in community development work, and I got work with Bernardo's. I worked fairly hard and I worked well, and I enjoyed the various jobs that I was doing, which was in child protection, working with young people, and then working in the communities, and then working with families. But every so often it would need time out. And during all of this, I was on all sorts of various medications, morphine, down again, cocodamol always there, codeine was always there throughout, antidepressants, because the chronic pain does get you depressed, there's no doubt about it, and you have to try and keep above that. Various complementary therapies, and even indeed in the middle of all this I trained to do Reiki, which actually proved quite good for me and helpful. Whatever the belief in it is, it's certainly very relaxing. Acupuncture helped, I've got to say. It gave me a bit of freedom for a couple of years almost, and helped for a couple of years, but always it came back down. And you
kept having flare-ups of pain.
Yeah, and then I was referred to a pain management clinic in London, which was nothing to do with medication, nothing to do with treatment, but it was a holistic thing, and that was the input at St Thomas's, and that taught me about relaxation, about the importance of stretches, about the importance of sleep, about how to sleep, how to manage your time. If you can't sit for more than 10 minutes, which was the case for me, then you sit for 8 minutes and you move on.
Okay.
And they give you little buzzers. So that helped then again for a period. But then again, and you try, and it keeps coming back, and it keeps coming back. And more types of physiotherapy, radiotherapy, sonic therapy, whatever there was thrown at me.
And then you end up did you have another discectomy or just straight for the spinal cord stimulator?
No, it was straight to the spinal cord. I'd had 2 discectomies.
So then you had the spinal cord stimulator put in.
Yeah.
And when was that?
That would have been around 2004 approximately. Thereabouts.
And was that helpful?
That did help. I mean, that was like a little bubbling... It's like a TENS machine in the spine.
Right.
And a little sort of bubbling sensation.
Yeah.
And you got a sort of an instant relief from that. And for a few years that went okay. But then, and that helped me through study. I was able to do a degree in psychology and a major part of a master's. But then after 5 years, I still, my knees, funny enough, would give way. My legs would give way, and I had some serious falls. I badly damaged my ankle when I was at home in Ireland visiting, just because my legs gave way. And then I had a fall in the house down onto the stairs. And I knew after that there seemed to be some damage to the stimulator.
Okay.
But it was due to be changed because it only lasted as long as the battery lasted. I didn't keep it on all the time like some people do, so hence it lasted for 5 years. And then I was taken in.
And you had it changed?
I had it changed, but that turned out to be quite a disaster, really. These operations are very painful because you're totally awake for 3 or 4 hours on your chest. And you can feel the pain because they're trying to find the spot that they were in, that it was in. They came out with because they had to change it, they didn't have the right new plug to bring the wire around from the back, because it was past its, I call it sell-by date. It was actually sterile. It was past its sterile date. So they had to try and get some sort of adapter to mix it. And as soon as I got back, I told them it wasn't working
It
properly.
wasn't working. And at this time, I think you met one of my other patients. You came to me from a recommendation from another patient.
That's right.
Yes.
That's right. My wife, who works as a director in a housing association, one of her team was a guy who was off for a very long term with virtually the same problem as I had. And she said to me, we're going to have to let him go, because you've got to remember, you can't even just work at home. It's not about that. You can't sit in front of a desk. So whatever. The chronic pain is one of the worst things to try and get someone to manage and work. And I couldn't work. And
I think we operated on him, and he did really well.
And he turned up at work one day. Yeah.
Yeah. I remember.
And said Joe needs to contact.
Okay. So you came to me. The MRI showed you had 2 worn discs. You went ahead and got the spinal cord stimulator removed.
Yes.
And then I operated on you in October
the 29th.
2012. So it's about 7 months ago.
12, yeah.
And we did an antibody, posterior lumbar antibody fusion at 2 levels. Yeah. Surgery went fine. I think you were in hospital only a few days. I can't remember how many.
Yeah, just 2 nights.
2 nights, okay. Yeah. And now it's been quite a journey for you. I mean, today you're 7 months down the road.
Yes.
You're just on paracetamol.
Yes.
And it's been quite a journey. So,
yes.
And I think it's also worth remembering that prior to surgery, you used a rollator to walk.
I used a rollator. I used a scooter to get around town.
And you could walk how many yards before pain?
Oh, before that it was to the end of the street. And,
so 50 yards, maybe 100 yards. Yeah. And now you're walking several miles. I mean,
the longest I've done is 5 miles. That, in fairness, that the coming off the morphine was difficult, and anyone that is coming off long-term medication should contact other people in your group to get advice.
So you've had 2 big struggles. One is coming off the morphine, and the other is coming off the antidepressants.
And the antidepressants, actually, in the end, was worse, because you have horrendous nightmares. You get suddenly very depressed. You have swings of emotions.
Yes.
And this is not doing your recovery any good. But I feel I'm coming out the other end. The pain is very, very low now. As I say, it's paracetamol. And before, it was massive amounts of morphine and other medication still. And the pain was excruciating.
Yes. And you came off the morphine just very, very slowly.
I came off very slowly, but it was still very difficult. I mean, very slowly.
Yeah, it's been a tough journey for you.
Very, very hard. It's been a long 27 years, and the end of it, in a strange way, sometimes toughest, because I had this elation. I knew it was right. I knew it had worked, but then the drugs was just no one could have warned you how difficult, and it makes you think about the dangers of having to be on long-term medication. Maybe I wouldn't have survived without it, but there needs to be, I think, more help within the health service.
For people coming off drugs?
Well, interestingly, the person that injured me would get help immediately to come off drugs. And I would go to my doctors, and all they could advise was just, you're going the right way. And yes, you will feel this, and yes, but the reality was, it was fairly horrendous.
I think you've shown extraordinary courage,
Thank you.
To have had the surgery and then come off all the medications that you have. And it's been tough on the family too, but...
my wife, we don't have children, and obviously my family in Ireland, and my wife, Helen, took the brunt of it, and it was very, very difficult for her.
So I'm sure it's great for her too, that, you've come out the other end of the tunnel.
Yeah, and I think there's a lot more to sort of battle against, in the sense of to get out there. And I went into this prison of pain 27 years ago. The world was different then. I'm coming out now, and the world is different again, and it is a bit scary, I've got to say. But doing it slowly and right. I'm not just ready for work yet, because.
But Joe, you're a tough guy, and I think you're gonna make it. So.
I certainly believe so.
Yeah. Well done.
I believe so.
Thank you.